السلام عليكم ورحمة الله وبركاته. I was trying to speak in Arabic, but because we have a guests, they will not understand Arabic, so I'll speak in English. So, بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله. السلام عليكم ورحمة الله. أنا عارف طبعا الوقت بتاعي تقريبا احنا في غدا بعد كده، مظبوط؟ After that one, فأنا I'm the one stopping between you and the lunch, so I will try to make my presentation very quickly, inshallah. My presentation, I'm trying to get the presentation to give you something after we finish the presentation. So I'm trying to get a lot of things. I'm working on the worldwide team, focus on the emerging market and Middle East and Africa for health solutions. So what I'm focused today, how the software, how the improve of the software technology through the innovation, improve the healthcare system. How we can make impacts, how we can get outcome. Sometimes we build the solutions, we build excellent solutions, but it's not used. There is no impact, there is no outcome. For many reasons, because I don't see the building capacity for people. I don't have an assessment after I build a solution, so I don't have an assessment cycle for that. Let us go for, this is my agenda, but I will try to quickly finish my presentations, and I need to receive a feedback and questions also. When we talk about health system, it's not only hospital and clinics, it is across. It's mean health providers, and this is the only things that we are talking about hospital and clinics. We are talking about health payers. This is the health insurance. And public health regarding the disease surveillance, public health systems, case management, disease tracking systems, and so on. And life sciences include all the research institutes and also regarding the pharmaceutical sectors. And actually we have a challenge now on all the health industry, and it's common. It's not only in Oman, it's not only in the Middle East, it's across the globe. It's regarding the how can we do more better services, how we can reduce the cost of the services and increase the quality of services. It's very simple. We have a shortage of labor, we have aging population, we have increasing the cost. If you need the high quality services, you need to pay more. Also we have, because it's a health industry, it's a business, and we have a technology. So we have also a challenge on the technology side. How we can secure our system, how we can make compliance, what is the standards, how we can take the data from data level to information level to knowledge level, because it's a completely different. If you have data today, it's useless. If I said Muhammad Saleh, Microsoft, it's data, useless. But if I said Muhammad Saleh, Microsoft, I give you an information that Muhammad Saleh is working in Microsoft. So data and information. And third, it's about knowledge. So if I get an history about what's Muhammad Saleh doing in Microsoft and his job, so I get a knowledge. I will give an example in our health industry day to day. If I said, I have a patient A, he went on a hospital. Okay, that's it, this is information. But what I need to go to the knowledge phase. What exactly this patient doing, what his activity, what's his procedures, what's the allergy, what's also the procedure he did it for the last 10 years. So this is the knowledge. After that, this is the technology trend. We need to change the work style, and we need to get the ICT support for newer devices. Also, when we have this challenge between the business and the technology, we need to address all the needs, all the connectors between the health professionals, policymakers, information, and citizen patient. This is Microsoft vision. We need to improve health around the world through software innovation. And this is why when we need to go the step ahead for innovations, Microsoft created 5 health research centers on the globe to address any challenge from the business perspective, from the product perspective, and from the technology perspective. So currently we have 5 health research centers to come up with innovative solutions. And what I will do today is just show you what exactly Microsoft did to prove that we are working on the innovative solutions for health. I need to also, because I differentiate from 2 minutes ago about data, information, and knowledge, I need to differentiate also today. It is about products, technology, and solutions. Because all the people mix between products, mix the technology, and mix the solutions. What we are proposing today, it's a solutions. Could be use the technology, could be use a product. I'll give an example. If you have today solution for telemedicine or teleconsultation, so I need to understand exactly what is the business challenge for the teleconsultations and what is the challenge of the telemedicine. So this is a solution part. How can I implement that? I'm using product. Could be Microsoft, could be non-Microsoft. What exactly the technology used? I can use video conferencing. I can use like live meetings. I can use like e-referral. I can refer my patient case to another place. So all this technology, it is already today, it's available. All of us, we have a Hotmail, we have a Google, we have the Hotmail, we have a Messenger. So all of us who are using the technology. How can I move from the technology part to the solution part? How can I use it as a teleconsultation? E-learning, how can I use it at telemedicine? So this is an innovation. So when I look for innovation on the health industry, it is very simple. Because still, we will have the doctor, we'll have the patients, and we'll have the hospital. We cannot remove all these 3. But the innovation here, it is about where we deliver care. Where? And second, how we deliver the care. And the third, who deliver the care. I'm giving an example about innovation that where we can have the care. Sometimes I need to give the patient the services, not on the hospital. I can give the patient the services on the pharmacy. I can give him services in the mall by have a vital sign, simple test, sugar level test. On his place, on his hand, is in home. So this is innovation, where the care will be happened. So I need to expand the reach of the patients sending us information, not on the hospital. Why he need to come to the hospital just to check the sugar level? So he can do it in home and send it to me. So this is the innovation where we can deliver care. And how we can deliver care, I need to send information to the patients. So I can use the mobile, so I can use the telemedicine, commodity devices. I can use also a self-services portal, so put like e-appointment. I can put e-notifications. I can use also e-referral. So all these services could be delivered to the patient in his home. And the third, who deliver the care? So it's a personal health record, teleconsultation, and health call centers. I think most of you maybe see this video before, but I have 2 versions to display the video. To explain the video first, and after that we'll see the video, or see the video after that explain. So the video will show you what's Microsoft innovation for the health industry for the coming 20 years. But before the video, I need to highlight that this video, it's already exists today. The product and the technology, it's already exists. Maybe the missing is how to link the product and technology to give you the proper solution. And this is what Microsoft unique. It is having a product factory, having the technology factory through the innovation, and we have the solutions already exist. So this is what we'll see in the video. It is about remote monitoring, virtual visits, hospital rounding, medication management, locating equipment, inpatient visit, virtual consultation, and retail clinic services. All these solutions already exist today, and the technology and the product already exist. But how to put it on a scenario, how to complete the patient scenario to achieve the outcome and the impact on the patients. Let us see the video, and I need to have a feedback. And if somebody, he need to talk me offline, so we can have this, or take the discussion offline. See the video. So what do you think? This is innovation. This is technology. This is product. This is solutions. This is complete scenario about what we can achieve. Maybe not today. It's already available. All the technology you see today, it's already available on the market. I can prove that this technology is already available. It's already used. how we can start here in Oman to build for our future 2050 plan. But we need to start. This is a solutions already exist on the market today, but how to apply it on our region, our Oman, our Middle East. But the journey should be started. And this is about innovation. What I need to mention that also regarding the technology and the products and the solutions, what is the outcome? What is the impact? Not on the hospital side, on the patient side. So we need to look to shift our mind, shift our focus from innovated hospitals to patient-centric services. Very important. Now we should put the patient on the center. If we put the patient on the center, I think we can improve a lot of things. Today, we are still looking for the traditional one. It is looking for how to enhance hospital. It's essential. But if we can look for the patient, could be enhance the services, enhances the hospital, enhances the workflow, give him a lot of services on his home, on his way. And this is a video showing you 3 things I talk about. Where we deliver care, where. So on the first slide or the first video, it's taking some of the health services on home. So where we can deliver. Second, how we'll deliver and who will deliver. So this is the 3 things we need to focus on innovation on health industry. Where, how, and who. Let us also, this is the second video I will present it. I'm trying to get you the reality, not slides and put a presentation and that's it. So the second video you'll see, how many one he know Xbox of Microsoft? Xbox. It's like a game, I'm right? It's innovation. It's using a sensor, a machine to sense the body, the contour of the body, and he tried to move the picture and play games. So the product already exists on the market, and the technology is already exists. How to move the product and technology to a solution phase, to a solution stage? This is a critical. This is a crucial now. Maybe I have a machine, I have a software, but I don't have solutions. I have a mobile phone, I have a SIM card, but I don't have services to call or send SMS message. It's useless. So let us go for, it's a gaming, but how Microsoft innovate the gaming practice to the health industry.
We know it's an easy way to have some fun and burn off some calories. Video game technologies are also being used for things like rehab, and now they've moved right into the operating room.
This is allowing me to travel through the body. By the image, I'm going now down the body, and I can see all the arteries and the veins.
So how is that possible? Xbox Kinect technology. It allows users to be hands-free through depth cameras that track your every move. Engineers have adapted that technology to give doctors what they need in the OR.
The idea was to just have a system that could control this imaging system without having to actually touch it.
It gives a whole new meaning to the idea of talking with your hands. Surgeons can manipulate imaging with specific programmed arm movements.
We can stop it. We can go backwards. We can stop it again. And we can go the other way.
Usually, when doing surgery that requires imaging, like removing cancerous tumors, doctors would have someone else manipulate the images on a computer or go to the computer themselves, use a mouse, and remember the image. And then they'd have to re-gown and re-glove since the computer isn't sterile. With this system, the surgeon never has to leave the patient's side.
It's not just saving you time, it's saving your concentration. Instead of having to be delayed from the moment that your mind remembers the image to the moment you have to get right back to the action, this completely eliminates those.
Doctors compare it to a GPS.
You move, it moves, it's telling you exactly where you are. It allows us to aim for this tumor, now carefully take it out.
The system has been used in about 6 surgeries so far, but the doctors and engineers need to do more testing with different types of surgeries. Once they've optimized it, it will be made widely available outside Sunnybrook.
This is another example about innovation and found the proper solutions to use the current existing technology and the current existing product on the market. So what I'm aiming also, this is available today in Oman. How we can sit down with the Ministry of Health and try to negotiate how we can build the solutions using this one. This is, again, another proposal I put on the table. So let us go for the, when we talk about innovation also, so it's not only just enhance something or you are recovering from the challenging or found the solution for a problem. If you look for the breadth of the innovation, how we can use natural user interface, like we see in the video, using the touch screens and surfaces and something like that. So this is from the consumer side till the data entry or the enterprise side to the right. How we can have the same user feeling when I use my machine, when I use my mobile, when I use my machine on the entry of the hospitals, it is user-friendly, it's the same interface. So this is the breadth of the innovations across from the consumer side till the enterprise side. Microsoft, when we are talking about the health industry, we should have cover from the patient side till the Ministry of Health side. So from the consumer side till the enterprise. Starting from the patient, moving ahead to the Ministry of Health headquarters side. So we have what is called a theme or solutions. It is modernization of health information, advanced collaboration, and secure and connect the infrastructure. So this is what we call connected health framework. It's called connected solution framework. It is our framework. It's available. You can download it from the internet. It's 700 pages explaining what Microsoft did for the past 10 years through 800 projects we did in health. So we get all this information from the 800 projects we did in health, and we build this framework. So this is just to explain you how we can start, how you can capitalize on your investment today. I know that we have a great system in Oman and is already working on most of the hospitals. But this is on the infrastructure side, the middle part. How we can build shared services, how we can build a solution on top, and how we can take care about the standards, the privacy, security, accessibility, and usability. And how this one will impact the social and how this one will impact the economies. I need just to highlight all on the shared services, like Professor Abdurrahman today, he mentioned that the Ministry of Health aiming to put e-notification, e-referral, e-notification, or e-prescription, or something like that. It should be on the shared services. All these solutions are available today. It's available from Microsoft and non-Microsoft companies. Let us start from what others end. Take it here, customize it for Oman, and let us start to go ahead. Before I have many things to present it, but I will go directly for a live demo because I was one of Ministry of Health employee before my sessions, and they asked if this solution exists about e-administration, e-referral, e-prescription. I said, yes, it's available. It's available on the internet? Yes, it's available on the internet. Can we see it? So we sit down before our session and show them. So I said, okay, let us connect it now. I'll show you what exactly Microsoft have. Maybe it is not Omani version, so we need to get the Omani version. But this is what we have today. Shift to the other one, please. Also, before I finish my presentation, if you need to remember one thing on my session, please, www.microsoft.com/health. This is the only things I need to remember today. You will find all the informations all my presentations, the video you see, all this information you will find it in www.microsoft.com/health. From that, you will find all these solutions already exist today. Business intelligence. Professor Abdurrahman, he asked about electronic medical record. It's already there. Also health portals, patient flow management, patient relation management. All these solutions already exist today. What mean exist? So if you, for example, I need to go to business intelligence, for example, application on health. He'll give you a brief description about what exactly business intelligence in healthcare, and you will find the case study, what solutions about the case study, document and downloads, and partners and products. So we'll find the solutions and you find the case study where this solution already implemented and who implement that solution. So you can start from the end, not from scratch. So also we have what's called Microsoft Common User Interface. We work with the National Health System on UK, and we work with others, agencies and another Ministry of Health. So we come with what is called Common User Interface. What exactly the common user interface for any health applications? How we can put the date format, how we can put the time format, the address, the allergy. All this, it's become science now. If I ask, what is the date format on a hospital? Somebody he said, okay, we need to put the year, month, and date. Somebody who said, no, I need to start with month and year only. If somebody asks you, what is the time format? We discovered that on the hospital or the health industry, we have 14 time format. 14. 14 time format on any applications. So the time format on the operation room is different than the time format on the patient registration room, is different than a time format on the bed management room. So the time format is different from one location to another within the hospital or within the clinic. And we built this one, it's a free. You can download it and use it. It's a free source code. You can use it. Or if you need to use it as a guidelines, so you can do that. And this is what I already discussed with the many of the Ministry of Health employees before the session. This is a patient journey. I have a patient administration online, I have a primary care online, and I have a secondary care online. So what I need to show you today or now is just this one. This is, I already linked to a server in UK on a virtual hospital we created as a Microsoft for demo for you to see. So now I can, for example, run this one, MRI. So I can put remarks. I said I have a problem here. I can write something. So I can flip. Also, live ECG. Now, you remember the three things: where, how, who. Where you will deliver the care. So maybe the doctor today is on Oman, and he's seeing the ECG of one patient on Salalah, for example, far away from here. No need to move the doctor from one place to another. If I have the technology, I have the product. So this is a live ECG coming from a server in UK for a virtual patient on wireless, very low speed. I'm using the wireless. I don't have Ethernet or something like that. It's a wireless. So talking about, for example, e-referral. I need to move one patient from one doctor to another. or from one clinic to another, or from one hospital to another hospital. So I have the first row. Now I'm a nurse in an administration, so I can move one patient from here to here. Just drag and drop. Or I need to move this patient to another hospital. What this means is moving the electronic medical file from one location to another location with a drag and drop. So this is a e-referral. I could put condition on the e-referral, like when you move from one place to another, I need to have these certain procedures to be done before I move. So the conditions. But here is open, so I can move this patient back to the clinic. So just drag and drop. This application is available today. We can integrate it with the current system. We have it on Sultanate Oman today. So move back to the presentation, please. So I will go quickly. So this is what we improving health around the world through the software innovation, and this is a complete solution set. So we built the platform. So the Sultanate Oman today, he did a great job on connected health platform. Now we are talking about shared services and the connected health solutions. We are looking for these shared services and the connected health solutions. This is a set of Microsoft solutions already exist today. So you need to go to www.microsoft.com/health and try to go one by one if you need it, and you will find a lot of information about that. This is, I put a scenario about the solutions we have. So what I did also from the secure and connect infrastructure, what you need to achieve. This is a scenario, this is the solutions. And also I map it to the product and the technology on right. So you remember the cycle, that product, technology, and solutions. So in this picture, I give you the scenario and the business and the product. And this is an example and the case study, evidence about how we can do and what we did with another customers. I need to scan quickly because my time is finished. How can I modernize health informations? Electronic medical record, imaging, electronic health record, business intelligence, health portal, enterprise resource. And I already mapped the solution to the Microsoft product. And this is an example also. And advanced collaboration, communication and collaboration, patient relation management and case coordination. And this is an example about what we did and what we achieved with which partner and which product. And so we need to lead the innovation, and Microsoft is committed to openness and standards. We have a great ecosystem, and we have a proactive community engagement. So we engage with WHO, United USAID, we connect with Johns Hopkins University, we connect with many of the big hospitals and entities. This all the information is available for you, so www.microsoft.com/health. And we need to start progress. We need to go ahead. Instead of receiving session and presentations, we need to engage. We have an office here in Sultanate Oman, alhamdulillah. We have a big team. And we have also in the Middle East and Africa, we have the support for the health industry. We have now 7 people, so we can engage with you directly. So by that, I already end. If somebody he need any questions, so I'm available. So if anyone he need to ask me anything, so I'm